Next up, I'd like to introduce you to Emma Baker, who's going to give us her lived experience perspective of prophylaxis treatment for VWD. She is the Deputy Chair of VWD Alliance, as well as being an ICU nurse. And I'd just like to, before she starts, just put a content warning out there that the next images do contain needles and injuries. So if for any reason you don't like seeing that, please just look away. So over to you, Emma.
Thanks very much, Kat, and yeah, thank you very much, Catherine. It's really interesting to hear your perspective. So, like Kat said, my name's Emma. From birth, and having female relatives with it, my parents were told I couldn't have von Willebrand's because I was a girl. The understanding also was that it couldn't be passed down from my dad, despite my granddad passing it down initially to my dad, my aunties, and my cousins. So like Kat said, I am a qualified nurse in Hull. I used to work in the busiest A&E of the region, which is the major trauma centre. And then I moved on to ICU, and that's also the major trauma centre. And we've got a specialist cardiac and a specialist neuro unit. It's a very busy job, and we deal with some very complex and very difficult cases. So I was inspired to be a nurse because of my experiences with von Willebrand's. I'm a huge advocate for those without a voice, and I often challenge doctors on the best decisions and the best interest of my patients. ICU patients are the sickest patients in the hospital, so often they can't speak for themselves. And from my experiences, I understand what it's like to be that patient at the other side, not being listened to and being ignored. So therefore, I try and be that voice if I can. I also wrote my degree dissertation on a critical analysis of the experience of women with von Willebrand's, and I used my experiences to influence the research I undertook. So because of my von Willebrand's, I spent quite a lot of my childhood in hospital. I had delayed treatment due to misunderstandings around von Willebrand's. I had the misconception of girls can't be bleeders, or it's just a nosebleed. Or I was told to sit and wait for hours so professionals could watch and see me bleed. When I was a child, I had no choices in my treatment. My parents were told that I only needed on-demand treatment, and I was never offered prophylaxis in an understandable way. We were also offered a port, but the risks of that outweighed the benefits, and we never went ahead because we didn't understand. I was always told, treat if you're bleeding. I had many traumatic experiences in the hospital, being pinned to the bed for treatment, huge bleeds that were ignored. I used to kick, bite, punch, scream, anything to stop doctors and nurses coming near me. The stress of the treatment, delays in the treatment, and delays fighting me often led to lengthy visits in the paediatric ward recovering. Haematology did offer to teach my parents to give me on-demand treatment at home, but because of how stressful treatment was and the eventual diagnosis of needle phobia, they declined. They wanted the doctors and nurses to be the bad guys who had to pin me down and stick me with needles, and they could be the good guys that gave me rewards afterwards. I did go through play therapy as a child to get over the fear of treatment, but this wasn't that effective because it gave me the understanding of why I needed treatment, but the care plan often wasn't followed and the de-escalation techniques weren't put in place. And there was also this language barrier between me as a child and professionals, because they'd say things like, this won't hurt or it's not painful, but all I could understand was hurt. When I started my period, I had constant bleeding. I had no breaks in the month. I was flooding pads and had large clots. And I was told multiple times by haematology that this was normal. The only help I was offered was to take tranexamic acid, but I was mostly told to just get on with it. I started my period when I was about 11 years old. And at 13, I saw a female haematologist who was shocked by my periods. And she told me that this was not normal. She got me on the contraceptive pill and suggested taking tranexamic acid regularly. So the contraceptive pill did work. It brought my periods into a cycle and gave me a break in the month from bleeding. But it did not bring down the severity of the period, and I was still flooding multiple pads every month. Also, I found tranexamic acid did very little to help for me. And getting access to the contraceptive pill was quite difficult. It was never explained to the GP why I needed it, and it was assumed that I was a sexually active 13-year-old, which as a teenager is extremely embarrassing. So I initially lived in Essex at the south of the country, and my care was taken over by Southend and London. As a teenager, I moved north to Lincolnshire, and care was taken over by Lincoln, which is quite a small hospital. Difficulties surrounding the dentist and wisdom teeth, my care was eventually taken over by Sheffield, which is a much bigger centre. And I'm so grateful to Sheffield because they were the first ones to suggest prophylaxis for my periods. For me, prophylaxis is treatment of factor VIII and von Willebrand's factor in an IV infusion as a preventative treatment for bleeds. I started using it just for my periods, but I now use it for all bleeds, and I use Von Cento. Like Kat mentioned, there are a couple of other medications available, but something like DDAVP doesn't work for me, and I find tranexamic acid does very little to help. For some people, they might only need prophylaxis before surgery, childbirth, something where a bleed is expected. But for others like myself, they'll be on long-term prophylaxis to prevent daily bleeding. It all depends on your factor levels and the severity of bleeding, and whether haematologists feel that it would benefit a patient. I resisted self-treatment and prophylaxis for many years due to the trauma surrounding injections. However, through lots of discussion with the team in Sheffield, we decided a dose a month of Von Cento during my period would benefit me. I started learning when I was 22 years old, and I found it extremely difficult to learn. I think this was mostly due to my anxiety. The veins in my hand are very large but bouncy, so I end up doing my prophylaxis one-handed in my right arm with my less dominant hand and backwards. I'm very protective of this vein. I think I was already a nurse when I learnt to self-inject, and I do think that helped massively overcome the anxiety surrounding injections. I also had a very good support network. The Sheffield nurses were so patient with me and saw me multiple times in clinic. And I had a friend who's an experienced paramedic who came round and helped me practice. I do have a public video on Instagram demonstrating an injection for prophylaxis and a recent video injecting for an active bleed. I was taught to go at a 45-degree angle, draw back blood so I don't inject air, and give very slowly. I probably inject slightly slower than I need to, but factor for me can make me go a little bit dizzy. And the needles in the injection boxes are little tiny orange ones, so going too quickly can be quite painful. I've had a lot of misses with my infusion, where I've tissued the vein, I've missed the vein, and when I first started, these mistakes would make me more anxious, and I'd end up making more mistakes. I don't miss as much anymore, and I think that's just because of experience and because I go so slowly. I find prophylaxis has massively helped my periods. I also now have the contraceptive implant, which has been a huge benefit. My periods are regular. They're about a week and a half long. And I've noticed massive improvement in other bleeds and bruises since being on prophylaxis. After discussion with haematology, they want me to inject more regularly. The advice that I'm now being given is treat for quality of life instead of just treating bleeds. This is a huge change of advice that I've been given my whole life, and I still find it very difficult to follow. I could be treating more regularly than I do, and I give prophylaxis for anything where I think I may induce a bleed. So, for example, I went ice skating for the first time last winter. I give once a month, sometimes 3 or 4 times a month, and I haven't had an overnight hospital admission in over 6 years. So just to finish off and round up, I just want to give my own little opinion on why treatment isn't offered to other people and why prophylaxis isn't offered more routinely. For me, prophylaxis has been a massive life changer, and I feel that it should be offered to more people with von Willebrand's. My parents were always told as a child that only severe haemophilia A self-treat, but my levels are as low as some patients with haemophilia, and my bleeds can be as severe, so that's very confusing. I think there's also a big misconception that von Willebrand's isn't as severe as haemophilia, which is why it isn't offered. I believe there isn't a universal understanding of what best practice for patients with von Willebrand's is, as each treatment centre and each haematologist seems to offer slightly different advice. I think some of that is due to the misconceptions surrounding von Willebrand's, but also a lack of understanding from the general medical community and a lack of diagnosis. So there are many people that would maybe benefit from prophylaxis and on-demand treatment, but instead they are undiagnosed and instead offered hysterectomies or other treatments that might not be necessary. It's quite difficult to change the understanding and the thinking around factor on treatment, when and why you should give factor. It's always seen treat the bleed, not treat quality of life. I'm aware that it's very expensive, which is one of the reasons I think I was only ever offered it for severe bleeding. The same advice has been given for the first 3 generations of bleeders in my family. But my youngest cousin, the 4th generation bleeder, has been offered to self-treat and give prophylaxis as a child. That is a new way of thinking. And lastly, I think as a bleeder, we need to be our own advocates. I think we need to discuss with haematology whether on-demand treatment or factor could be of benefit, whether prophylaxis may prevent bleeding in the first place, whether it's benefit for you to learn. It does depend on your levels as to whether or not it's worth it, but it's always worth opening up that discussion. If the discussion is being had and the need for prophylaxis and treatment for more patients is being seen, it could prompt more research and funding into easier ways of treatment, such as subcut injections instead of infusions. Thank you very much for your time. Back to you, Kat.
Thank you so much, Emma. I said this the other day, but actually, sharing your story, it's a really personal and quite a vulnerable thing to do. So thank you so much for sharing it. I think we can all appreciate hugely what you've been through. And actually, when I've heard you speak about this, I think it gives us hope, right? Actually, you've been through all of this and now you're on prophylaxis, and actually that's great, but we can still demand more. So yeah, thank you so much.